watching Quad Cities Live.
There is a new treatment option available for Trinity Heart Center patients right here in the Quad Cities. The technology is called pulsed field ablation that manages heart rhythm disorders. And here to tell us all about it is Pulley, Director of Cardiology Services at UnityPoint Health, along with Dr. Shen, who is a cardiac electrophysiologist and cardiologist. I hope I got all those words
Correct.
correct. Okay, good. Okay, so let's get started. Dr. Shen, this treatment, this is for patients with atrial fibrillation. So what is that?
Yeah, so atrial fibrillation, I'll call it AFib, is the problem with the heart. It's the most common heart rhythm disorders in our Americans here. The atrium is the top chambers of the heart. Fibrillation is quivering. So the top chamber decided to quiver. It can cause all sorts of symptoms such as heart racing, dizziness, fatigue, shortness of breath. And then it can cause some serious complications such as stroke, heart failure, heart attack, and so on.
Okay, yes, that was one of my questions, is what can happen if it's left untreated? Obviously, those are symptoms that would bring people to you in the very first place. I mean, it is hard to live with that dizziness and just not being able to feel like you can live your life.
That's correct. That's correct. So AFib is a serious disease, and some people actually, they don't feel really bad. But, we are worried about the long-term, complications that can affect the people's lifestyle and then lifespan as well.
Yeah,
yes.
Absolutely. Okay, Dr. Shen, so explain pulsed field ablation, how it works, and I guess what makes it such a promising treatment for AFib.
Correct. So ablation is one way to treat atrial fibrillation, and I would argue that is the most effective way. Pulse field ablation, or sometimes you hear people say PFA, is one type of ablation compared to the traditional types of ablation where you heat up the tissue or freeze the tissue. We call it thermal ablation. Pulse field ablation, or PFA, utilize a very high intensity of electricity to destroy the cells. We destroy the cells that generate atrial fibrillation, thereby controlling the rhythm, restore the normal rhythm. And the advantage of PFA, that's probably your next question, compared to the existing or before, the traditional thermal ablations, is that because if it's non-thermal, it can spare the neighboring organs when we do the ablation inside the heart. And it's highly effective, highly efficient. We finish a case skin to skin, oftentimes within an hour.
Oh, wow.
And it's quite safe. And I would say this is a revolutionized technology for us. And fortunately, at UnityPoint, we have been doing this for over 6 months now, and the results now is very, very satisfactory.
That's exciting, and it's exciting to have an option that won't necessarily damage tissues around where you're working on this issue. So, Kathy, Trinity Heart Center was among the first hospitals in the nation to offer this technology. That's pretty amazing.
Yeah, absolutely. We're very proud of that. Our mission in the Quad Cities is to be the heart center for our community and take the best care of the hearts that we possibly can. We have amazing physicians like Dr. Shen on board, along with our very high quality nurses and our radiation technologists that are very passionate about heart care. So one of our focuses is always being aware of the new procedures and technology and making sure that we are bringing them to our community.
Yeah, I would have to ask, I mean, being able to have access to a solution like this, a treatment like this, has it brought people in, from, neighboring areas that wouldn't potentially be here? Has it brought them to Trinity?
Yeah, well, I'm sure Dr. Shen is nodding yes, that he sees patients from outside the area. But, most importantly is that our community now doesn't have to leave the area for these cutting-edge treatments. And so that's what we want. We want the highest quality care right here at home.
Absolutely, because, I mean, when you're going through something and, oftentimes I would say a decade ago, a lot of people would, have to leave and go to Iowa City or out of state or something like that to receive certain treatments, and we're getting that right here in the Quad Cities.
Absolutely.
That's very cool. Yeah. So talk a little bit more, Kathy, about how this advancement specifically really aligns with your mission at UnityPoint.
Yeah, well, again, like I said, our mission is to take the best care of the Quad City hearts.
Yeah.
And so continuing to look for those cutting edge evidence-based treatments that are going to improve patient outcomes that's what we do.
Yeah, amazing.
Yeah.
And Dr. Shen, I know you just touched on this briefly, but I wanted to ask you again before we let you go. So if a patient is talking with their cardiologist about this potentially being an option for them for AFib, what can they expect as far as procedure is concerned? I mean, I think you said something along the lines of an hour and recovery.
Right, right. So PFA, or pulse field ablation, is an outpatient procedure.
Wow.
Where you go to the hospital, empty stomach. We do it under general anesthesia. We still go through the right groin, which is a super highway to the heart. And the procedure usually take about an hour.
Wow.
And the patients, you know, after a brief bed rest, they typically go home the same day.
Amazing.
Yeah.
Yeah.
And typically, take it about a week, take it easy, you know, no weightlifting to more than 10 pounds, but people can go back to their usual lifestyle pretty quick.
All right, well, thank you so much for answering.
Yeah.
I'm sure
Thank
a lot
you.
of people are watching this and asking that, so we appreciate it.
Yeah.
Well, if you want to learn more, visit unitypoint.org and click on Find a Service, located right there at the top of the page. You can also call the number on your screen, 309-779-5340. Kathy, Dr. Shen, thank you so much for chatting with us about this today. We really appreciate it.
Thank you.
Thanks for having us.
Of course,
Yeah,
yes. Well, still to come on QC.